Thanks everyone for joining us today. As I said before, I'm Dr. Marco Bardos, convener of the SPHR network. I'm pleased to introduce Dr. Zhaozhang Sun, who's going to talk about influences in health communication and how her project is being informed by narratives related to diabetes and anti-stigma. Dr. Zhaozhang Sun is a research fellow at the University of Birmingham, and her research lies at the intersection between digital health communication, chronic disease management, and behavioral health interventions, with a strong interdisciplinary focus and commitment to translating research into impactful real-world applications. Without much further ado, I would let Dr. Zoe start the presentation, and we can get on. Just for you to know, I'll give you about 30 minutes for the presentation. I'll give you about 2 minutes warning in case we go beyond that.
Okay, thanks. Let me share my screen. Yep, that's good.
Yes, we can see it.
Okay.
The floor is yours.
Okay, thank you. So, hi everyone. Thank you so much for joining today's webinar, and I'm so happy to virtually meet all of you. And it's been, I think, a long time since I joined this SPHR network, and I really think today's webinar is a perfect opportunity for me to introduce myself and also my research. So I'm Zhaozhang Sun. I'm currently the research fellow at the University of Birmingham, and I work with Marco, and yeah, he's my academic mentor. Today, I'm more than happy to cover some information and share with you my research. Well, I'll firstly provide a brief overview of my research background, explain some major concepts related to my research, and then go on with my PhD project and my current fellowship project. There's also one section of the reflections on my experience of doing the interdisciplinary health communication research. And also, finally, we will have time for you to ask questions at the end. Yeah, so I'll just give you a brief introduction of myself. I studied media and communication in my bachelor's and master's, and after that, I became an international journalist at a national media in China. After that, I decided to do my PhD in health communication, combining my expertise in communication with healthcare context. Then after finishing my PhD last year in August, I obtained one fellowship from ESRC Center UB, and then doing my research fellow role, focusing on project on reducing the type 2 diabetes stigma. So overall, I focused on my on digital media communication and in healthcare sectors. Well, just give you a brief overview of the key concepts. First one is health communication. So put it simple, I can only say that health communication is just communicating things about health. And it means sharing the information in a way that people can understand health issues, making decisions, and even taking actions to protect or improve their health conditions. Well, but from the academic perspective, there's one well-recognized definition of health communication. We can see that it highlights the interdisciplinary nature of this discipline and highlighted that the ultimate goal of health communication practice and research is to improve individual, community, and public health outcomes. And the scholars also highlighted the importance of effective health communication practice, and that one of the major importance is to persuade audience to change their beliefs or behaviors towards certain health issues. From that way, we can say that the communication process and health communication practice is not only about informing or disseminating or just posting things. They're related to persuade, motivate, support, and support people to make changes. Well, the media landscape the media landscape also changes due to the wide use of social media platform, and more people start searching and obtaining information online. While we all recognize that the varying quality and consistency of information also put a threat on people's health communication activities on social media, so they may consider what kind of information they should believe, and whether that kind of information can inform them to take the correct actions. And due to the complex nature of communication process, we can know that each part of the changes, no matter from senders messages or the receivers, that can impact the effectiveness of the communication process. So that comes to the second major concept of my research, that is social media influencers. While that was widely discussed in influencer marketing, because they have large number of followings, those persons are highly respected, connected, informed, and exposed on social media, and their followers consider the information disseminated by those social media influencers are reliable, and even though their information can influence their buying behaviors to purchase certain product. Well, based on those kind of information, I'm thinking whether I can do or do the research, thinking of using the power of social media influencers in marketing and advertising field into health-related contexts, to play a role in promoting health-related outcomes, changing people's behaviors. Yeah, and then I just took the lines of diabetes because that's really a great and significant health issues that impact people's life, and that the serious and the status is serious in both in the UK and in China. And then based on those information that comes to my PhD study, I examined health communication and the diabetes narratives of key social media influencers in the UK. So I've already know the potential power of health communication, and I know maybe social media influencers in health context have the power to impact people's knowledge, attitude, and behaviors. So I just want to explore whether that could happen. And narrative is a way for persuading people, because it's a nature of communicating, telling people story, and it's easier to persuade people to believe or understand certain things. Well, there are four major questions for my PhD study. First one is to identify who are the key diabetes-related social media influencers in the UK. And second, what diabetes-related narratives presented by diabetes-related social media influencers. And then the third one focused on health communication practices. I just explored the internal and external factors that may impact those influencers' online communication practices. And finally, I explored the potential implications those narratives have on their audience's knowledge, attitude, and behaviors. Well, I use a mixed method, including the social network analysis, narrative analysis, semantic analysis, and statistical analysis. Well, and I also made and developed three innovative research methods, because the current research method may hard to exactly answer my research question. For instance, I developed one social network-based influencer identification model. That model was based on the traditional influencer identification model in computer science and influencer marketing studies, but I added 5 more attributes from communication perspective. For instance, their content, their impact of content on treating the audience engagement, the replies, the retweet, and any other connections. Also, I developed one Twitter-based integrated diabetes narrative exploration framework because I consider that the narrative on social media is not the same of narrative in daily life, especially on Twitter that have the word limitation of 140 and then 2080 character that made the narrative maybe into pieces, the fragile. So I developed that one based using the qualitative and quantitative method. And also for the SMIKAB questionnaire, that is a questionnaire aiming to examine the implications of those content disseminated by social media influencers on their audience knowledge, attitude, and behaviors. Although we know that there's loads of influential and well-organized questionnaire that could be used to examine the people's medical-related outcomes. But I think the main issue I would like to focus is the potential of influencers on those people's understanding and their attitude and behaviors. So I added certain metrics related to the influencers' potential and their implications. Yeah. So there's the 4K major findings. First one is I argue that health-related social media influencers is a distinct and unique set of influencers that's different from influencers in marketing and advertising. They can be either organizational or independent influencers. And also in the group of independent influencers, they can either be healthcare professionals or people with lived experience. And they can, based on their role on social media and their role in communicating certain diabetes-related issues, they can be classified as opinion leaders, information facilitators, and highly interactive content creators. And they collectively disseminate diabetes narrative, mainly focus on three major parts of the information. First one is diabetes-related information, second is COVID-19 and vaccines, and thirdly is healthcare and well-being. I think maybe that because that my research just conducted during the COVID-19, so that's the major part of the information, that is real-time conversation. And then regarding to the influencing factors, there are a multi-level of factors combined such as for the organizational influencers, they have organizational mission, social responsibility, and for personal influencers, they may influenced by the perceived benefits and risks, and also the COVID-19 and influencers' career role play an important role for organizations to make their communication strategy plan, and for the independent influencers to choose what kind of information they would like to disseminate on social media. But they have the ultimate one same goal to that is to influence people to understand and to even take the healthy behaviors based on the information they process, they disseminated. And lastly, regarding the impact of those influencers on their audiences, my research found that that the influencers do have the positive impact on improving people's knowledge and attitude, but they have limited direct impact on changing people's behaviors. Well, that is my PhD project findings, and I also got some output based on my PhD study. I'm currently in the process of writing and finalizing my book based on my PhD thesis. And after completing my PhD, I'm just thinking and want to take a next step from understanding the influence of influencers to actually using those knowledge and influences to make some difference in certain practical practices. So that's where my fellowship, current fellowship comes from. Well, my PhD study found that there are several factors influence the effectiveness of health communication practice, and the diabetes-related stigma is one of the most significant factors influences influence communication practice and also audience perception and their audience activities on obtaining the information and also on taking certain actions. Well, so I focused on my for my fellowship project, I focus on type 2 diabetes stigma, and I would like to try to develop and evaluate the social media campaign to reduce type 2 diabetes stigma by working with not only social media influencers, but also other related stakeholders. Well, so the major aim is to improve public health, public understanding and reduce stigma surrounding type 2 diabetes through a social media campaign. Well, there are three major phases to achieve that. First part is to do the literature review to understand stigma and to know whether there are certain effective communication strategies that could help to reduce diabetes stigma. And second part is the major part to conduct the co-design workshop to bring together people living with type 2 diabetes, healthcare professionals, communication experts to develop a campaign handbook, just including all the information and agenda and also the recommendations for creating the campaign material. After that, I'll partner with social media influencers to create campaign content. Actually, the content will be created by those influencers, but follow certain campaign handbook. And then after the launch of the campaign, I'll evaluate the impact of this campaign in reducing stigma and fostering the community engagement using the qualitative and quantitative method. Well, till now, I'm in the process of preparing for the co-design workshop that will happen in early May and has been scheduled. And I've finished the first round of literature review, and there's also some stigma policy related experts who would like to join as a external advisor committee members to provide their expertise in helping me to better manage and organize this campaign. Well, yeah, the workshop is scheduled in the early May and is fully booked. And also there's loads of people showed their interest and willingness to voluntarily participate to join this conversation and provide their expertise and insights. That's really exciting. That's far more than I expected. And I also made some preparation for the workshop that would like to that would like to act as a basic information to provide to everyone who would like to join this workshop, asking them and maybe facilitating the conversation. So what stigma look like, and what's the impact of diabetes stigma, what the challenges for stigma in healthcare sector context, and what can we do about that? Is there any stigma related to taking the insulin or medicine? And also what kind of language way it might not be used during the campaign? So yeah, I made some preparation for the coming workshop. Till now, I've also wanted to maybe submit some other the one more abstract to the conference based on my current project progress, and luckily if we can know more after the handbook was created, yeah, I'd also like to share the findings with you if you are interested. And hopefully I hope that this project can helped me to step further, not only broaden my understanding of the role of social media influencers in health communication practice, but also have some short-term and long-term impact on people living with type 2 diabetes. And the reason why I would like to invite the policy advisor, stigma advisor, and also communication advisor, healthcare professionals, is and that I really believe that when you want to develop a campaign that for people with type 2 diabetes, you need to involve people living with type 2 diabetes in this project, and also the other significant stakeholders that will be involved in the designing and the implementing this intervention or this campaign that's meaningful. So finally, that's my reflections on my current work doing this interdisciplinary health communication research, both my PhD and my current fellowship project. Actually, the reason why I studied more than 10 years of communication and then doing the research also in the context of health communication is that I really believe the impact and the potential of communication in influencing people's daily life and also helping people to better understand the world and manage their personal life. So and I also know that the change doesn't happen overnight. So we should maybe uh, provide more opportunities, explore more, and to know whether there's any potential that we can help them to finally achieve that goal. And what I'm currently doing is trying to influence the influencers and to know whether that will work in the near future. Yeah. And just to finish, and I'm more than happy to provide some interesting ideas based on my current project and the experience. Actually, one of the core research goal of my is to investigate the potential of health communication in addressing health inequality by examining how effective messaging, digital intervention, and media strategies can reduce those disparities across the diverse populations. And I very welcome you if you'd like to work with me or stay in touch, or you would like to contribute to my research or workshop. Yeah, wish you have a wonderful day. Thank you so much.
Okay, excellent. Thank you, Zhaozhang, for sharing this interesting presentation. I think you finished earlier than planned, so it's okay. We can have now more discussion. I think I will leave. I'll see if someone is willing to ask questions. Either pop them in the chat or as a Q&A. Oh, Andras, please take.
Yes, thank you.
Okay. Hi.
Thanks
Nice to
very
see you.
much. Yeah, nice to see you again, Marco. Yeah, thanks very much for the presentation, Zhaozhang. I think it was a really exciting. I like the, yeah, I would just love to know more about your PhD. It was very dense how you had to present it, but I don't want to spend time on that now because obviously the project you're working on is kind of more actual. I had two questions about it. Maybe the first one that might be kind of more interesting is on slide, well, 3.2, when you showed the steps of your fellowship project. So step 2 was about the co-design.
Mhm.
And I was wondering why you decided to separate influencers from all the rest of the people, right? So it seems that in step 2, you don't have any social media content providers or content creators participating in a co-design. Could you tell us about why you made that decision? I can keep them separate.
Yeah, that's really a good question, I think. I've thought about that before. Actually, I decided in the first stage, I think this is really a great way to invite all of the people in one group. Then we can just make the discussion, foster everything. But later, I think there's some, I don't know whether I can use the power imbalance or things like that.
Mhm.
But from the audience perspective, such as people living with type 2 diabetes, when the healthcare professional also in that group or the influencers also in that group, whether the conversation can go smoothly, whether they would like to express their general and the interest or in their insights or perspective towards their daily control or daily life highs and lows of their condition. So that's one of my concern. And also for the influencers, I'm also considering their maybe willingness to spend their time joining those workshop, maybe 2 and also 2 more hours, in total 4 hours a workshop with people, because maybe they want to focus much more time on spending the time to create the content, just trigger the engagement on social media platform. And also for the communication and campaign managers, I think that's the similar. They have expertise. If they just raise one communication strategy that could be used in this campaign, but people living with type 2 diabetes, they don't think though, what should that happen? So I think also for the handbook, I decided to maybe separate into several sections from the perspective of people living with type 2. What are the major things or the priority they consider should be solved in this campaign? And for the healthcare professionals, what they consider they have experienced or observed the stigma happen in their healthcare sectors. Maybe the things the healthcare professionals raised are also the similar things that people living with type 2 raised. Yeah, that's the reason why I separate them into the different group.
Yeah. So if I get it right, what you're saying is that there's a very, very strong reason for you, the researcher, being kind of a mediator between the kind of the patient group or so and the professionals because of power imbalance and availability. Yeah, that sounds like a cool argument. Yeah, I think I'm buying that. Yeah, cool. Thank you.
Thank you.
If I may add here, as a mentor, we discussed this also with our colleagues who are part of the mentoring team. So Professor Yazim Alpion from sociology, who's studying celebrities, and he is also bringing in the perspective of social media influencers as celebrities. They're not all celebrities, but they have also this power, this aura, if you want, about that is being given by the social network or something, or their experience and also their visibility, that also can put off some people and therefore reduce the potential of a focus group or a workshop in this case. Just to add this point, yeah, I think that you covered it excellently. Are there any other follow-up questions, Andres?
I would give the floor to others, and maybe I'll come back later with my second one.
Thank you. We have a Q&A from the web here. So Gufran says, "Hi, Dr. Sun. I'm in the process of working on my PhD, and I'm hoping to use a co-design to develop a digital intervention with adolescents. How did you approach recruiting participants for your workshop, and were there any considerations you took into account when preparing materials in advance of the workshop?" That's a good question.
Yeah, that's a good question. Actually, you can say that for my PhD study, I never used co-design as a research method. So before doing this project, I also feel that I need to learn more from other, no matter that's toolkits or the websites, and also ask my peers who have already did the co-design in their PhDs to share some useful information with me to help me know how to do that, use those kind of method in my research. And regarding your question for recruiting the participants, I think firstly, I just made the recruitment plan with my mentor team that think no matter the timeline or the procedures, that's important. And before that, you should maybe evaluate whether all the steps is practical, that's workable, and you can manage that in the time frame. And then after that, that's the next and the priority step is to apply for the ethical approval, that the team will also give you some advice on helping you to think some ethical things. Also, maybe I remember that the ethical team also raised one question for me. If you would like to recruit the healthcare professionals, how could you ensure that they won't use their time that won't impact their working as the NHS workers or something like that. So that encouraged me to thought about the time arrangement, and then I scheduled the workshop on weekends. Yeah, that's also good advice based on the team. After that, I decided I just designed the recruitment material, including the posters, the short messages, and I also developed one project website for just presenting all the information and also including the link for people to click to show their interest. After that, I use the social media platforms, no matter my not only including my personal account, but also invited some diabetes related organizations and networks to repost, trying to boost on social media platform. And since the first round of the recruitment goes great, but not enough communication and healthcare professionals included, I specifically made another plan to recruit the second round to recruit those people. And so I just sent the invitation letter to the person who in charge of those network, asking whether they could help me to spread out. And then, yeah, after second round, I got enough participants. And then, yeah, hopefully the workshop could go great. Yeah.
Maybe you can elaborate more again on the strategy for recruitment and probably tell us a bit more about the results you obtained, which I know that are quite good.
Yeah, I never saw that it could go really well. We made several forms, several rounds of forms to ask people to show their interest before. Actually, we cannot recruit any participant before we got the ethical approval, but you can still ask them to show their interest, not collecting personal data, just show their interest, letting them know, letting you know that they would like to, or their willingness to be contacted when you got the ethical approval. So in the beginning, I've already got some interest. Yeah, people have showed their interest to join. And after I got the ethical approval, I just started the formal recruitment procedures, and no matter using the Canvas trained to posters, also the social media platforms. And after that, there's a third round of forms, I think, that's related to the information sheet, consent form, things like that. And till now, there's a total of 123 person have already signed the consent form, and 24 of them have been invited to the first round of workshop. And yeah, there's 4 more experts would like to join as a advisor to provide their insights and expertise. Yeah.
So maybe you can give a piece of advice for researcher doing a similar process with adolescents then. Probably the target group is slightly different, but what would you recommend doing?
Actually, I think maybe why it goes smoothly, you just mentioned me, because I do my PhD in diabetes, so I've already followed or know some of the social media account in the diabetes community that's built up, have already built up. Then when I do my fellowship project, I just posted the recruitment post, and then some of them just help me to repost it. But I think if you do in other contexts, first one to know who are the key active social media account or the network are searching that, know who you can learn from, and trying to, yeah, and that's also a good way to help you to learn the new insights coming from your field. And then if you'd like to invite people, you can join their community, online community, and know if there are any connections. You can join for online seminars or webinars to know people in this field. Yeah, that's also a good way, because when you follow them, or not, maybe also on LinkedIn, then you can send the invitation message to them whether they would like to contribute. And yeah, hopefully that your project will also go smoothly.
Okay, excellent. Are there any more questions? Yes, Andres, I see your hand
Yes,
waving.
thank you. Yeah, it's just about the the number of participants. It's huge, right? So for a co-design kind of study, having 100 and something, 23 or more people, it's a huge number. And I understand that you said that you'll have 24 in the first workshop, right? But could that still sounds maybe on the higher side, but I don't have a lot of experience with this. But could you tell us a bit about how you plan to manage these sessions, these workshops?
Yeah, I read some literature. They suggest that maybe 4 to 12 is the appropriate size of the workshop, no matter online or offline. And so I decided, firstly, I think maybe I'm thinking, I'm just trying to thought that maybe I was in the workshop with people, 6 more people. I think maybe 8 it could be, or 8 to 10 could be a good number. And then due to the we discussed the power imbalance maybe between those groups, I decided to separate those people into 3 groups. So one group is 8 people living with type 2 diabetes. The other 8 is healthcare professionals, and then the 8 communication expert. Yeah, that's only the first round, because I would like to know what those groups of people, their perspective provide the broader information. But the second round of workshop may focus on trying to make the consensus about the information they discussed in the conversation. Yeah, and because I have more than 100, and actually I tried to maybe purposely maximize the diversity of the participant, but for the invitation procedure, I just broadly send all the information to ask them to yeah, because I don't want to maybe as a researcher to personally just influence who can join this conversation. Yeah, but due to the budget limit, I can't invite too much people. But if people show their interest, they would like to voluntarily join, I may maybe conduct 2 more, no matter they are people with lived experience or other experts. Yeah, that's my current concern. And actually, I haven't conducted 1 workshop till now. That will happen 1 week after. And I built the agenda, and I just also submitted that to ethical committee. They approved that, which means maybe the procedure looks practical. But regarding the presentation for the workshop, that what I will provide to them and how to lead them or facilitate the conversation, I also got some ideas, and also look the 2 case to help me to know how to do that. Yeah, currently all the materials nearly finished, but need to polish and need to maybe reviewed also by my mentor team before that happened. yeah, because they have
Yeah.
much experience. I know Marco, he had done several workshops before, yeah, and with lots of people in diverse contact, yeah.
Yeah. Yeah, sounds like a sound plan, and I'm just yeah, I will be curious to see how you will go through with this, and then also thinking just about the publication of these, like how will you present this, whether you'll present this as a standard code design, but then will you not get criticism on having too many people and not having enough time to really work with a smaller group, or will you pitch it as a not as a code design, but kind of a broader participatory workshop thing. So that will be exciting to see. But definitely I think it's great that you reach so many people. So something will happen. So that's the point.
Yeah, we'll see how that goes.
Yeah.
And I'll always keep an eye on learning the experience, that if anyone have that kind of experience, I'm more than happy to learn. Yeah.
Thanks.
Are there other questions? See, I'll try to see if others. Okay, Leslie. Hello, Leslie.
Hiya.
Another
Thanks
familiar
for-
face.
Yeah.
Please go ahead.
Lovely. Thank you so much for your presentation. It was great, and it sparked lots of thoughts in my head. However, I'll keep it to one comment and one question. So one comment was, and a long time ago, I was a clinician. I worked with people with diabetes as an occupational therapist, and the infographics that you've produced, I thought were absolutely spot on. I think they'll be an amazing way to communicate, succinctly with healthcare professionals. In particular, I think to try and reduce stigma. So yeah, that looks great. Thank you. And from a health literacy point of view as well, for influencers and people with diabetes as well. Great. So my question comes on to something that you mentioned in your fellowship, is you're looking about health inclusion and health inequalities, and I wondered if you could speak a wee bit more about that, what you're aiming to look for, what made you think about that for your fellowship. I know it's a buzzword at the moment, but I'm sure there was sort of things that you saw in your PhD that struck a bit, struck a chord, and you wanted to pull into your fellowship. Thank you.
Yeah, thanks for your kind word and also your questions regarding to this health inequality issue. Actually, that comes from my PhD study. The third question, there's one major factors that impact the effective of health communication practice. The influencers and also audiences highlighted that there's audience inequality. No matter that socioeconomic inequality, the health literature inequality, and also the social media literature inequality, and that the one of the most frequently mentioned is the diabetes stigma. But before that, I think maybe stigma had happened. Before I finished my interview, I think maybe stigma happened between people living with type 2 diabetes, because I saw that majority of people on social media who are actively engaging in diabetes conversation are people living with type 1, because they yeah. But after that, I understand that both type 1 and type 2 and other type of such as gestational diabetes, they all have stigma. And I think maybe that's from my understanding, just my personal perspectives, I think that's a kind of inequality between the people in health within their health conditions. And in order to maybe trying to overcome that in this social media campaign, I think I would like to focus much on more exploring the communication strategies, no matter what kind of language they use or what kind of participations perspective will be included in the discussions. So that's also the reason why I think no matter the ages, the ethnicity, or their genders, or their maybe locations, the geographic information, things like that can impact the findings of this project and also the creation of the handbook. So I'm in the draft in my ideally the draft in my mind for the handbook. I think there's might be one section for the useful materials and the tools that could be used for people in different area or under different conditions. And I also found there's one new question raised in IDF 2025 conference. There's type 5 diabetes related to the nutrition imbalance that caused the diabetes. I think that's also interesting. That just raised maybe 5 or 1 week ago. But if we can also include this news and letting people to know that in our handbook and helping people to raise awareness of certain issues, I think that's the way we would like to trying to overcome those inequality, also information inequality, the communication strategy inequality, and yeah. And I maybe for the follow-up fellowship project, I want to focus much more on the underrepresented populations. For instance, the diabetes, in the diabetes context, maybe women with Black British women under 40s have diabetes that have already been highlighted in the report. They are underrepresented populations, whether I can focus on doing that part to help to overcome those inequality. Yeah, that's the future plan. Thanks.
That's amazing. Thank you. And good luck with your work. It sounds great and much needed.
Thank you.
Okay, are there any more interventions? I have some suggestions here. I think part of these webinars, part of the purpose of these webinars is to stimulate thinking and ideas and share ideas and opportunities here. We've been working with Diabetes UK as a charity, part of the partner of this project. I think there are other opportunities for other charities that would benefit from this kind of work, I think. Next week, we have Professor Claire Jinks talking about osteoarthritis, and she's going to talk about her work related to the stigma associated or the misconception about osteoarthritis, which I think are very well aligned with what you're doing. So it could be like your methodology, you're applying your methodology to other problems. I think you have I would say a career pathway set for you, in the health communication domain here. But I was thinking also if you wanted to expand this work, your fellowship is 1 year long, so it's quite short, and we're making plans how to extend this work. What would you do? So where would you focus on? I'm not saying what would you do differently, but what based on what you know now, based on what you will know by the end of September, what would you do next?
Yeah, I was thinking about that before. That's a good question. Yeah, actually, I'm thinking what's the research findings for this fellowship project, whether that's work tested or evaluate is impactful, it's changed, or it have no change, it's not was doing or have no other influence on people's understanding. So if the findings is different, I would like to explore why that happened. And I would like to know whether the power imbalance or power related things in diabetes community impact people's understanding and impact whether people change certain behaviors or not, and whether and also with the development of digital tools, I'm also want to explore whether certain power imbalance impact the people's willingness to use certain new technology tools for managing their diabetes related, for personal management. And for if regarding to a reasonable, I think, trajectory. I've exploring the potential of social media influencers in health communication in my PhD, but no certain impact on influencing people's behavior. And then I use the potential of influencers in improving people's understanding, trying to know whether they can influence people's understanding of diabetes, type 2 diabetes, to reduce the stigma. But if that happens to have no impact, I need to explore from the theoretical perspective to know why that happens, the mechanism to explain why it doesn't happen, and what can we do to know more about that, how to make that happen in social media context, and also especially for digital health communication interventions. Yeah, so just a short summarize. First thing might be focused on underrepresented population, and then maybe focus on theoretical perspective, and also to explore whether that can be used in other health related conditions. Yeah.
Okay, excellent. I'm gonna throw very quickly something there. Also focus on the message itself. So you're focusing on the messenger. So who's gonna speak about the topic, and changing stigma is not directly a behavior, but the way you talk about something, that's how you express the behavior related to that issue. So I think changing that, the impact of your campaign might be measured in a different way. So we have to be careful in deciding how do we measure impact in this context. What behaviors are we considering? How can we observe, assess these behaviors, and how this can be linked back to the campaign itself? That's a different story, I would say. But I would say moving forward could be looking at how the campaign itself has been designed, the message itself, the content, the visuals. We have some work done with the colleagues in John Moores University in Liverpool that look at eye tracking, and how people perceive and read a message, or pay attention to some specific elements of a visual that could be incorporated here, and saying we want to see now, we have a messenger, then we put it in art, and then let's see what the impact of it is. And it's a very short impact, of course. See how people, in which parts of the image they spend time on with eye tracking software. And this could be then saying, making recommendations to Asthma Lung UK, Diabetes UK, breast cancer awareness, breast cancer now, I don't know. Other charities then say, look, you can use this as a way to persuade people about this specific topic, this specific issue. But I'm just throwing out ideas. Looking at the time, so we have 5 more minutes, and we have another question that's very interesting on the Q&A section here. How do you think you would be able to moderate content related to your intervention once it's on social media? Social media is also a planned component to my intervention, and the lack of control of content on social media once it's published is the concern that has been raised by others regarding my planned work. What would you say on this?
Let me raise the question to ensure that I'm fully understand.
Yeah, you can see it from in the Q&A.
Yeah.
Click down. So how can you moderate content related to your intervention once it's on social media, especially relying on social media influencers, so you cannot control what they say, right?
Yeah, that's really hard to control. I know, I totally understand. And especially for the information posted by social media influencers or the celebrities, because they have large number of followings. And I think for the researcher, from my perspective, I think the thing that I can do is before the campaign, after they creating the content, we have 2 rounds of reviewer to know that kind of information, whether that have the potential to raise the controversial conversation, or that may trigger the hot or the negative discussion. We can say first, and in that team we have also experts and communication the specialist to provide the idea, and also the stigma related expert. So but after you post it, the the only thing you can do is to monitor when you have time to say how that happens. What should we do if that happened? Maybe extremely negative or things like that, and discuss with the one who posted on social media, cause that's their account. The info, although that's they help you to create the information, but posted by their account, and they have their own free of choice to say. But the 2 round of maybe reviewer process, I think that's really important, because in my PhD study, the Diabetes UK digital manager, he told me that they have 2 teams, the 2 round of navigating and monitoring teams, to say that how that happens. But that's really a concern and a problem. Trying to be patient and also trying to explain things, maybe trying to avoid controversy is a way of communicating, how you communicate if that happens. Yeah, that's also the things that we would look, I'd like to learn to know. Yeah.
And I would say, well, I mean, if it's misinformation, you can always report it. And you as a user, let's say you read that post is on Twitter, you can report it as misleading or something like that. So someone will deal with that. That's one way to block misinformation, but of course it's laborious. It's not necessarily automated. If we talk about narratives, it's probably working closer with the developers of the content, so with the influencers, to explain what is important, to double check the information. So in a sense, you'll be the expert that will come back to you and say, can you verify this before I post it? So I think this is what you can hope to achieve in this context, saying they will come to you, or they will come to Diabetes UK and say, can you approve this before I post it? In a sense, you want them to become more journalists then social media influencers just, I want to post whatever I want, let me do whatever I want.
Yeah, that's also the reason why there's some social media team. The team of members just trying to solving that kind of problem.
So we have 1 minute left. I think if there isn't any burning question or comment. If that's the case, I think I just want to remind you that we have a next webinar next week on the 7th of May, same time, 12 till 1 UK time, British summer time, with Professor Claire Jeans talking about osteoarthritis. So explaining osteoarthritis well, this is the title of the webinar. What are the next steps for health communication research? And I think she will share with us some ideas and insight on what could be done to develop further research on this area. And then if you want to know more about other webinar series, Amy just posted in the chat a link. And if you want to remain connected with with this network, please do join us. There's a link below also in the chat. So with this in mind, I thank you very much for all your comments, your questions, your interactions, and look forward to seeing you again in the future.